So we have the lumen of the trachea is up above. This is a pseudostratified ciliated columnar epithelium. Mucus-producing glands here. So I'll go up in power and we'll take a look at it. And then beyond that is going to be hyaline cartilage, C-shaped rings in her trachea. I mean, you can feel them when you go down your throat here. And there's the hyaline cartilage. It's going to go around the other side, but it's not going to meet. There's going to be a muscle in between those. Excuse me, those ends. It's called the trachealis muscle, and that allows us to change the diameter of our trachea. If we need to cough, we need to force out air. Okay, so there's a pseudostratified ciliated columnar epithelium. The lumen of the trachea is up above. And a little bit of fat down here, some connective tissue, mucin-secreting glands, and we come down and hyaline cartilage right there. And the perichondrium, you can see on the far side, much clearer than on the inner side, right there. Now, I'll go to lower power, and we'll sweep back up, and we'll go find that trachealis muscle. And it doesn't matter which way we go, because it's, as I said, it's going to go up just like this, so we'll just go up on this side. The cartilage ends right there, and then we have the trachealis muscle, smooth muscle, connected to the cartilage over on this side. And the esophagus would be sitting right in that position. And there are the nuclei of the smooth muscle cells in this trachealis muscle. So it is stimulated by the autonomic nervous system. Sympathetic division is going to relax that muscle, so it's going to get bigger, so you can move more air. Parasympathetic is going to contract it, make it smaller. Okay, now we have ovary, and we see 3 different follicles here. The primordial follicle is going to look like a little black dot with a white circle around it. That's the one that in human females, they are born with all potential gametes they have, and they are called primordial follicles. And they're in a state of suspended animation. They've started meiosis 1, but they all then are suspended in that activity to be turned on years later. So there's a primordial follicle, there's a primordial follicle, another one. And they develop into primary follicles, and the primary follicles look like these. And they have a layer of cells around them. Okay, so there's a primary follicle, another one. Again, as we talked last week, the reason for, I mean, one only wants to, ovulate one gamete, potential gamete, and fertilize it to have a single child. But the reason for doing maybe 3 dozen or so is that they produce a hormone, and one doesn't produce enough to get the lining of the uterus ready for an implantation if fertilization should occur. So there's primary follicles, and one of them will develop into a secondary follicle. Now sometimes you can have more than one. That would be the case if you had a fraternal birth. So you had 2 ovulations at the same, during the same cycle, fertilized by 2 different sperm cells, and you can have fraternal twins. And here's the secondary follicle right here. It has this C-shaped space that's filled with fluid, and when luteinizing hormone spikes at the middle of the cycle, it causes smooth muscle back on this side to contract, and that compresses that fluid or squeezes on that fluid and forces the secondary oocyte out from the wall of the ovary. These are nurse cells around, and some will accompany it and protect it, and the rest are going to stay behind and form what's called the corpus luteum. There's one here and there's one there, this came from a rabbit. So the corpus luteum is a temporary endocrine gland. It's going to produce progesterone, a little bit of estrogen, primarily progesterone. Yes?
Doesn't the secondary, or what's left of the secondary follicle what's left of the secondary follicle, doesn't that turn into corpus luteum?
Yeah, that's what I was pointing to there. That's the remnant. I mean, the cells that were here. Okay, the cells that are around this secondary oocyte right here are called nurse cells. Everything is called a nurse cell, you know, in this structure. So some of them are going to go with this. The other ones are going to go here. They're going to become the corpus luteum. They're going to become a temporary endocrine gland. Yes.
Is that oocyte the one? Does that go out and sometimes form cysts? Is that what might?
That's what will be ovulated right here. This.
Right, and is that what could form into an ovarian cyst?
No. The follicle is the gamete, the potential gamete.
I thought that's what a cyst was when follicle isn't, it just sits there and ends up on the outside of
Yeah,
the...
but that's going to be ovulated. That's going to be the gamete.
Okay.
Summer, did you have a question?
Oh, can you just zoom it out one last time so I can see the whole thing? Please? Thank you.
Okay. Okay, this is a section through the compartment of the testes. It's a single tube that winds down and back, and it's called the seminiferous tubule. That's where sperm cells are produced in the male. And the heads of the sperm cells are the dark profiles you see right here. The tails are the flagella that are sitting like this. So that's the seminiferous tubule. Sperm cells will go up and look at it. The cells to the outside here are called interstitial cells of the lady, and they produce testosterone in the male. Okay, so in the handout that I gave you last week, the process going from the potential gamete to the ovulated potential gamete takes 2 weeks in a female. In a male, it takes 2.5 months to go from the stem cell that's out to the outside to form what's called a spermatid, and then to undergo this morphologic change to become a sperm cell and grow flagellum so it can eat hell. Okay, this was the This is tongue, and we're looking at fungiform papillae on the surface of the tongue, and we see taste buds. And I was looking around, I found another slide where you actually can see the taste bud better, and you can see where it looks like the taste hair is sticking out. I'll put that up in a second. So this is stratified squamous, non-characterized epithelium. Taste buds are along the side. In fungiform, in phyloform papillae, they're just spiky. They don't have any taste buds. And here's a phyloform papilla. Okay, no taste buds with those. And then I found this one. And the taste bud is right here, and it looks like you can see the opening on the side. Not that we're going to have 3 tongue slides on practical, but you can see where, so you have taste cells and supporting cells, and you can see the openings right there. So it's going to stick out a taste hair out there and detect whatever the taste happens to be in the environment.